guys! Okay, so today I wanted to do a postnatal haul, meaning all the stuff that I've bought for after I've had the baby, and this is kind of like postnatal care and kind of how to ease yourself into motherhood when you've got really sore bits down below. And I've got a few things here that I bought off Amazon, and yeah, let's get started, and I hope this video is super helpful for you. Okay, so first things first, when you have a baby you will bleed. Regardless of whether you've had a cesarean or a vaginal delivery, you will bleed a lot. And without getting too TMI, but obviously I can't help you if I'm not going to get too in detail, sometimes you will pass clots, and I remember sitting in the car and when you're kind of sitting, all your blood kind of like coagulates, doesn't it? But yeah, I was passing like clots like that. So you'll need some super thick sanitary pads, and these are literally the length of the packet, so as you can see they are pretty big, and you can use these just with your own underwear or with disposable underwear depending on what you fancy and whatever is more comfortable for you. If you don't want to use the pads, you can use these. These are really cute. This product is by Tenor, and they are actually black, and they are low-waisted, which is how I normally wear my underwear. And it's designed more for incontinence, which again you may have after you have a baby anyway, but it just kind of helps kind of keep everything in. And I like them especially for bed, because when you sleep you move around a lot and you're picking up your baby and feeding it and things like that. So I'm going to find these really helpful, just like I did last time around. So after you have stopped that initial large amount of bleeding, which normally is about a week to 2 weeks, you can go down to the smaller pads. These are by Always, and I don't know, I just really like the design of them, but they are nice and long, especially at the back, so you've still got that protection, but it's just like a thinner absorbency. Now you're going to be changing your pads a lot, and what I like to do is put them in a sanitary bag, and I took these to hospital with me when I had Harry and Charlie, and it's nice just to put, you know, your pads in it first, or your, you know, dirty knickers, things like that. So I use these are just sanitary disposable bags, and I found them really, really helpful. So along with the pads, I found these really helpful. You can pick these up anywhere. Make sure they are kind of unscented. These are vagina wipes, and they just kind of make you feel a little bit more fresh, especially when you're really sore down there. They're really actually nice and refreshing. So when I had my other two boys, I had grazes, and with Harry, he was actually a compound presentation, which means that I had to birth his head and his hand like this, and his elbow must have like grazed me as it came out, so I had two. I had one on one side and one on the other. With Charlie, only had one graze, and I remember actually saying to the midwives, like, have I torn, and they were like, we can't see anything, there's so much blood. So I've got a couple of things here that I've heard good things about that I think are really going to help. This is a spray bottle, and all you do is just fill it with lovely lukewarm water, and there's a little nozzle here, and it's got little holes in it, and you literally direct it to your bits and spray. And because your urine's really acidic, it can like burn like cuts and tears and things like that. So I'm going to be using this, and hopefully it will help. Now, along with the spray bottle, I've actually got a mini bidet, and it actually looks quite big, but it just sits over the toilet, and you just put water and salt in it, and you can just give yourself a little salt bath. I found doing this in the bath was really good, but this kind of saves having to like fill up a whole bath, and it saves a little bit on water. But it's just a mini bidet, and again you can wee into it so that it's not going to sting your cuts. But yeah, I can't wait to use this because I think it's going to be really helpful. So that's all the vagina things. I have got these Lancino breast pads, and I found these the best out of any brand. I tried Asda's own, Sainsbury's own, Tesco's own, and I tried like the thick, the thin, I tried Boots's, and these are the best. They've got a little sticky bit on the back that you can stick inside your bra, and they just stay in place, and I really like them. It's funny actually, because when I was nursing Charlie, I had like an oversupply, and can you hear that alarm? Why do things like this happen when I try and film a video? I remember he had slept for I think more than 2 hours. My boobs were so full of milk and so engorged, and I remember just like picking like the breast pad out of my bra and just like dropping it into the bin, and it was like a wet fish. It hit the bin really loudly. It was really funny. But yeah, so these are the best. And also along with these, I have also got the Lancino manual breast pump. Now I haven't actually tried this one before, but I will open it up and show you. It actually comes with some little milk bags as well, which I thought were really cute because I love using those. So it comes with a bottle and you just screw it on like this. And I have actually got a electric breast pump, which is the Medela one, and I found out of all the electrics that I've used, the Medela one is definitely the best. Now this is manual, and this is perfect for just getting off that first little bit of milk, because when your breasts are so engorged, there's no way you can latch your baby onto the nipple, because it's like trying to latch a baby onto a watermelon or like a bowling ball. Like, you're not going to be able to do it. Your breast has got to be soft so the baby can get the whole mouth around it. Especially after I had Charlie, this was amazing because I could just pop it on, express off a little bit, just make them a little bit softer, and then I could latch baby on, and it was a lot more comfortable, and he didn't have to like draw the nipple out so much because it was like hidden in all this like breast tissue. So that is a good tip that I'm going to pass on to you guys because I found it a lot easier. Now, when you get engorged, the best thing to do obviously is to pump, but also you can get a cabbage and just like trim off a few leaves and put them in your bra, and it's really, really soothing. You can also get these gel packs, and they're like the shape of a, I don't know, flying saucer or whatever, and you put them on and they are so soothing. But I also found really helpful was getting in the shower and just manually expressing just a little bit off and making sure that up here, because your milk ducts actually go all the way up to here and like under your armpit, so you've got to really like massage, and you can use your knuckles, just like gently massage all the way around to make sure that you're emptying the breast. Otherwise what will happen is you may get mastitis, which is what I had with Charlie. And I was literally, it was the evening time, I think Harry had gone to bed, Charlie was just having like his witching hour, you know, where they like nurse forever in the evening, and I had a really bad pain on this side, and I was like shaking, I had a fever, I felt like I had flu, and I got in the bath, and it was actually a bit of a pain because at the time I didn't have a manual breast pump, I just had my electric one. So Matt had to hook, like the nearest plug socket to our bathroom is literally here where I'm sitting, so he had to like daisy chain loads of like electric cables all the way over to the bathroom so I could sit in the bath with the shower with my breast pump on and just like massage and cry and pump, and it was so awful. So you don't really want to get to that stage, but obviously there is things you can do, all the things that I've explained in this video, to reduce the risk of getting mastitis. Now in the beginning, I mean, everyone's milk comes in different days. The normal is like 3 days, and then you think to yourself, well, hang on a minute, if my baby's not got any milk for 3 days, what am I going to do? So the first milk is actually colostrum, which is like bright yellow, and if your baby actually throws up at all when they're first born, you will see all this like bright yellow liquid coming out of their mouth, and it's like, what the hell is that? It's just the really rich colostrum. It's full of like antibodies and stuff like that. So for the first couple of days, you will find that they're just having little bits of that, and their stomach is so tiny, it's probably like the size of a marble, something like that. So they really, really don't need a lot. But as they nurse, it stimulates your breast to make more milk. And day 2 with Charlie, I found that he was like gulping milk. And I thought, well, that's strange. But I didn't realise my milk was going to come in on day 2, but it did. And he would do like these long gulps and like this sucking like this, and I remember actually it was so cute. So I don't even know how babies know how to do it, but they just do it. He did this thing called flutter feeding, where he would go and then pause and then pause, and with his tongue he was just gently stimulating the milk, and then suddenly it would all come down and he'd be like gulp, 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 and it was so cute. It was like a little baby bird. But yeah, that's something that I remember, and it was just amazing. But I remember getting really sore on one side. You have to go back and like watch my old videos. But I remember getting really sore on this side and not so much on this side. And I think it's because, you know, your breasts and nipples are shaped slightly differently. So when I'd latch him onto this side, it was really sore and it would like crack and bleed. So what I did to get over that was I either used a nipple shield, or the second thing, I just changed position. So rather than doing like a cross cradle, I actually had him in like the football hold like this. So I'd hold his little head like this in my hand and actually latch him on like that. And the way that his mouth then went onto my boob, it was less painful as he was taking the milk out. So I didn't just stop feeding altogether on one side until it healed. I just used my cream and then I just latched him on, and it was just so much more comfy like that. Now, one thing I did struggle with, and I wanted you guys to actually help me out a little bit and leave me comments down below if you guys had it, I had a really painful letdown. So basically he would do the little like flutter feed, like, and then suddenly I would feel this massive pain just as I could feel all the milk rushing down like this, and then just before it came out it was so painful, and then it would come out, and then oh, the relief. And it was really strange. I don't know why I had this painful letdown, and it went on for maybe a couple of weeks. And I remember Matt being like dead asleep in the middle of the night, and I'd be feeding Charlie, and I'm like, Matt, hold my hand, the letdown's coming, just and I'll be like breathing through it. I mean, guys, I thought I had a really good pain threshold, but subsequent babies like is telling me that I'm not very good with pain at all. But yeah, so he would hold my hand whilst he was like asleep and just like flop his hands on me and be like, it's okay, wife. And then obviously the letdown would come, and then Charlie would nurse, and then he would take the milk away. And it was really interesting because as soon as he was done on one side, I could begin with, I'm just giving you an example, I've got breast implants so it's easier to show you. So to begin with, my breast was like this, and you could see it was right up here on my collarbone. And then as I would pump using my electric pump, which was actually really noisy during the night. So I'd pump and it would reduce it a little bit, and then as I nursed, my breasts would come down and then they would just go soft like this. And it's really fascinating to see the difference between the two, because then the next time you feed, you've then got this huge boob on this side, and you're sort of like squeezing them, like which side do I need to feed next? And to begin with, my body kind of oversupplied because it didn't know how much milk my baby needed. So I could probably have fed like quadruplets, like the amount of milk that I had. But after a few weeks, your body gets into a rhythm and it realizes that you only need that amount of milk for that baby. Obviously, if you pump, so for example, I would pump on one side and nurse him on the other, so I actually had like twice as much. And then I would freeze it, and then if, you know, Matt needed to feed him, if I was in the bath or something, he could just defrost it, la la la. So I hope this video helps, kind of like postnatal care and then a little bit of breastfeeding tips. Give this video a thumbs up if you like it, subscribe to me for free to follow my journey. I will see you in my next video. Bye ladies!